am Dr. Manon Fielding, and today we're here talking about why do women always bear the brunt of poor medical decisions. Part 1, from laudanum to lobotomies, and now to estrogen. And always may be a little strong of a word because I am finding out now that men's hormonal issues have been pretty neglected as well, except for erectile dysfunction, right? But the rest of it, nobody seems to have paid much attention to men and their issues. But today we're talking about us, about women. Let's get started. So back in the 1800s, kind of 1840-ish, there were many people on the road selling things to women, and the cough medicine was one of them, and it contained a good dose of heroin. And of course, it became very popular, and many women got addicted to that. And they also took a lot, especially upper class women were given doses of laudanum, which was a combination of opium and alcohol. So they weren't the ones as much in the opium dens, but physicians would give laudanum to women to help manage all the symptoms of women's ills, anxiety, depression, and any kind of menopausal issues. They were given laudanum, and they didn't feel pretty good and didn't really worry about those things after a while. But then, like I said, a lot of them did get addicted. And the laudanum was actually even given to babies to help calm them down. Imagine that. A lot of women became addicted, and there was a real surge in this opiate addiction, and they kind of had to deal with that and stopped prescribing laudanum. And then we had other issues. Okay, so let's get to that. So as things got evolved in the 1940s, women bought these vitamin tonics that had a high alcohol content and contributed to alcohol issues among women, and depression and anxiety developed even more strongly, and they were given lobotomies because they didn't really need their frontal lobe, right? And when they demonstrated severe mood swings, depression, and hormonal imbalances, the results of hormonal imbalances. And this picture here of Lucy, let me point that out. Let's see. So I don't know if you've ever seen it, but it's a very old episode of I Love Lucy. And I remember this being very funny. It's called Vita Meta Vegemin. And they tell her to take a little bit and give her a little spiel about how good it tasted and tell a little bit about it on this commercial. And by the end of the commercial, after many takes, she is like, oh, this tastes so good. I think I'll have a little bit more. It was basically a little bit of satire about what was happening at that time. And then a little bit later, not that much, in the 1950s, that's when tranquilizers came out, and they started being prescribed widely for all kinds of physical and emotional ailments. And this also led to widespread addiction, and actually still does, but not as much because they're giving different kinds of medications now. But there's a lot of it is being given for hormonal imbalances that actually can be controlled so much better and healthier. And that's what we're going to be talking more about. Here's a picture on the left side here of the lobotomy. And if you've ever seen any of the old movies where they gave a woman a lobotomy afterwards, she's just real chill, not a lot of emotion, basically personality kind of gone because they're destroying the part of the brain that gets excited and has emotions. So just imagine something fairly emotionless. Kind of scary, really. And it was done to quite a few women. So now we have our own contemporary challenges. And the drug du jour is estrogen. And I don't have anything against HRT or being given estrogen. It's just that it is often more than it should be, let's put it that way, being given indiscriminately. And we're going to talk more about that. So it can be overprescribed, and it seems to help many women, and they're very thrilled with it, just like women felt about having tranquilizers or having their vitamin regimen. But a lot of doctors are unaware of this condition called estrogen dominance. And it could have really devastating and very serious consequences. And I'm going to explain a little bit about what it is and how this happens. So estrogen dominance is a condition when you have a higher level of estrogen relative to progesterone. And there's a certain balance that needs to be maintained throughout our lives, and that difference actually does change, obviously, between our reproductive years and our menopause years. And here's some of the factors that happen is one, you can have an overproduction of estrogen, so that is self-induced. It could be that estrogen isn't metabolized and excreted properly, and because there are different modes that it happens in our liver, which is the main organ where it gets excreted from, and we have different phases of excretion and detoxification, phase 1, phase 2, phase 3. And when we can also have an imbalance in the ratio. So we may be overproducing it, we have a problem with metabolizing and removing it, and then we have the imbalance in the ratio. So those are things that actually happen physiologically. And now we're going to talk about some of the reasons that some of the things that a physician should be doing in response to this, and what some of the symptoms are. Like, how do you recognize it in yourself? So these symptoms can happen in premenopause, perimenopause, postmenopause for various reasons. Of course, premenopausal, you might have irregular menstrual periods. That can also happen in perimenopause because you're still menstruating, and it could be very varied. Have really significant breast tenderness, weight gain, mood swings, fatigue is a very common one, headaches, insomnia, fibrocystic breast disease, significant water retention above normal. It could actually lead to breast cancer, is one of the serious consequences, uterine cancer, hypothyroidism, Hashimoto's, which is an autoimmune disease of the thyroid, and decreased libido. So all of those can be based in this estrogen dominance condition. All right, we talked about what it is, and we talked about some of the symptoms, and this is 3 of the reasons that it can occur. You can have an increased production of estrogen. You may not be making enough or having enough progesterone to balance the estrogen, which could be your own physiology or induced by your physician, by what you're taking. And it could be self-induced also if you're taking the wrong supplements. And then how you're metabolizing or detoxing the estrogen. So all of these can be related to taking HRT or taking other kinds of supplements and things indiscriminately and not knowing what your balance is. So fixing it depends strongly on which of these factors or combination of factors are influencing that estrogen dominance. And it's important to know how it's happening and why it's happening in order to know how to fix it. So there are different ways that we can tell by your symptoms and more definitively by testing. And I prefer the in-depth test like the 24-hour Dutch Complete because it can help determine more specifically what your issues are and not just dealing in the dark with, well, let's try this or let's try that. We'll be able to see which of these is actually the problem or combination of. And the actual correcting it and talking a little more in depth about estrogen dominance we're going to be doing in part 2, but we're going to look at a few things modifications that you can make without testing that you can determine what's going on and perhaps do something about it without having all that detail, which does really help in the long run. Okay, so the important thing that I want is for you to be educated about how this happens and what you can do about it and how to recognize it so that you are taking control of your own health care. That's what's important to me. So one of the reasons it can happen is that you can have inadequate monitoring where you're given some kind of you're on HRT or some other kind of program and you're not being monitored properly. And this could also be your fault too. Like you may not go back for a follow-up because you're like, well, I feel great. I don't really need to do that. Or you start having symptoms and you don't realize that they're related to that and you don't go back. But if you're not monitored and tested so that you know that you're on the right dose or that you're on the right program, you don't really know what is happening inside and what to do about it. You also could be given the improper dosage. Maybe you're not getting enough or you're getting too much. If you're getting too much, obviously that is a sign of estrogen dominance because you're going to be putting more into your body than your body needs, and maybe it has a hard time removing it and you can't really clear that much out. You didn't need that much in the first place, and that could definitely lead to this estrogen dominance. A lack of personalized approach. So part of the problem with HRT is they're only created in certain dosages, although they're supposed to be like the typical dosages, but there's just so much you can titrate with those. And it may not, your doctor may just give everyone the same dosage to start with and then see what happens, like a one-size-fits-all approach, and not taking into consideration your age, your medical history, and symptoms, and looking at the potentially estrogen dominant symptoms that you may already have. The duration of therapy. So if it's prolonged beyond a certain point and you don't really need it anymore, maybe other lifestyle changes have happened in your life and maybe you don't need as much. So the duration of therapy is an important aspect. So, what's shown in the literature is that you really shouldn't be on HRT longer than about 5 years. And that's when it starts having more potential side effects. But if you are going to be on it longer, you have to be monitored properly. All right, and the last one is the interaction with other medications. And I'm not going to go into a lot of detail on exactly which ones, but there are a number of medications that interfere with hormonal metabolism. And if you're being given estrogen and or progesterone and it's interacting with your medications, you might be having an interaction drug reaction, and that can cause a hormonal imbalance. And that's really important to know. And testing can bring that out. So if you feel like you have any of those symptoms that we reviewed and you want to try to mitigate it at this point, one of the things you can do is take a good progesterone supplement. And I strongly recommend this particular product, the molecular progesterone complex, because it is easy to dose. gently take 3 drops and put it on the inside of your cheek. It is much more better, highly absorbed. It has a good effect on the brain through the blood. It can go through the blood-brain barrier in most circumstances, which does help with calming and help with anxiety, which are with some of those side effects. And it gets utilized much better than some of the other types of creams or the other types of pills, especially because a lot of women have problems in their gut and they're not digesting their food or their supplements very well, and they don't utilize that as well. So I do highly recommend this. The molecular progesterone complex, like I said, better absorption and utilization. The other thing is stress reducing, and utilizing stress reducing techniques like meditation, heart math, and many others that we teach in our program does help with the estrogen dominance, and it may be, kind of get you through until you can get testing. You might find that it's very beneficial. Also, eating a healthy, low, simple carb diet, organic especially, and eating things in the brassica family helps with the detox of estrogen, like Brussels sprouts, cauliflower, broccoli. Those kind of vegetables that are in that family can be very helpful to clear out any excess estrogen. And my favorite that I talk about on a lot of my videos is exercise, exercise, exercise. It's really an answer to almost all of our ills, much more than taking any kind of medications, and it does help to keep our hormonal balance. And when you meet women who say that they went through menopause without a lot of problems, almost all of them you'll find are doing some form of regular exercise. So I did want to stress that. So I hope you enjoyed part 1 of this presentation. In part 2, we're going to talk a little bit more in detail about estrogen dominance and give a more in-depth look about how the testing will give you more detailed understanding of what exactly is happening. Is there just not enough progesterone? Is there too much estrogen? Are you not metabolizing it properly? And sometimes you can actually give supplements that will help to change the way you're metabolizing estrogen so that you won't have those symptoms. So again, I'm Dr. Manon Fielding with the Natural Menopause Anti-Aging Club, and I'd love to invite you to join us, and we look forward to seeing you on the next show, part 2. Bye-bye for now.